My name is Dr. David Lott. I am a laryngeal surgeon at the Mayo Clinic in Arizona. I serve as the director of the Mayo Clinic Arizona Voice Program and also as director of the Mayo Clinic Arizona Head and Neck Regeneration Program. My co-author is Dr. Jeff Janis, who is at Mayo Clinic in Rochester. And his area of expertise and research is on bone and cartilage regeneration, and he's a head and neck surgeon in Rochester. The name of our article is Tissue Engineering in Otorhinolaryngology, Head and Neck Surgery. Basically what this article is about is a summary of all the different tissue engineering research projects that are going on for head and neck structures. And the head and neck encompasses many different structural types and functional types. They include the 5 different senses. It includes facial animation. It includes swallowing, breathing, speaking, and eating. And so as you can imagine, the types of research and the types of tissues that we're having to work with are vastly different. The importance of tissue regeneration research for head and neck structures is that these are very important in patient quality of life. And to this point, we have no reconstructive options that restore function as it was truly intended to be. So take, for example, the larynx. If a defect occurs in the larynx, that patient can have a difficult time with swallowing, speaking, or breathing. And right now we have no way to reconstruct that. You can transplant a larynx, but then the patient is on lifetime immunosuppression, which has its own drawbacks. With tissue engineering, it enables that patient to have a functional replacement with their own tissue that no longer requires immunosuppression. That is a main theme throughout all head and neck regeneration research, is how do we regenerate functional native tissue for replacement. We are learning which types of progenitor cells, meaning which types of stem cells or early cells are best suited for each specific site within the head and neck. And then how do we take those cells and form them into a functional tissue. So again, for the larynx is how do you regenerate the different subsites even of the larynx to produce a functional voice and still allow for swallowing and breathing. For bony regeneration of the jaw, what is the best way to get cortical bone or hard bone that can withstand the different traumatic forces on the mandible. And so we're basically just going to build off of what we're doing.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.com. This video content is copyrighted by Mayo Foundation for Medical Education and Research.